الرحيم ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي اللهم فقهنا في الدين اللهم فقهنا في الدين اللهم فقهنا في الدين ربي زدني علما ربي زدني علما ربي زدني علما آمين. Alhamdulillah, our speaker today, I am Farheen Nasir and I'm going to be your host today. And our speaker is Sister Shabana. Today we're going to be talking about our mental health issues and our Islamic perspective on it. And inshallah, Sister Shabana Haxton, she was born in Pakistan and raised in Northern California. She got her Bachelors of Science in Health Services and Masters of Science in Nursing from Sonoma State University, and also her Psychiatric Nurse Practitioner from Cal State San Marcos. And she works for Kaiser Permanente for the Riverside service area as a depression care and emotional care specialist. She's very passionate about mental health issues, especially in youth, and is working to educate and increase awareness in her community. Alhamdulillah. She helps couples and families with relationship issues, individual therapy, and medication management as well. She is, mashallah, a mother of 2 beautiful children, and she has been married to her best friend for 24 years. Mashallah. May you have many, many more years to come. Happy years to come with your relationship, inshallah. Dear Sister Shabana, I would like you to come and take the mic, inshallah.
Okay. Assalamu alaikum, everybody. I am going to go ahead and share my screen. So Sister Farheen, can you stop sharing?
Sure, I just did.
Okay, got it. You guys can see my screen now?
Yes, we can.
Alhamdulillah. Bismillah ar-Rahman ar-Rahim. So my name is Shabana Haxton, and I'm a psych nurse practitioner working for Kaiser, just like Farheen said, and I now have my private practice here in Corona. So I do, either teletherapy or even in person. But I'm really passionate about mental health issues. I see that, every day, but I also see it a lot in our community. So this talk, of course, if we were to talk about mental health with Islamic perspective, that's like a 2 or 3 days kind of workshop. So I just wanted to increase the awareness. I want to make sure that everybody knows that, mental health is not a kind of like a taboo subject to talk about, which we actually do. Daily, I can, get people daily. I just spoke to a young lady, 20 years old, who's like going through so much stuff, but her parents are like, are you stupid kind of thing, just, get over it kind of thing. And that shouldn't be the case. So alhamdulillah, I am working with a organization called Families Project. It's a peaceful families project, and we work really hard to inform our imams and stuff for domestic violence. And there's a difference between domestic violence and interpersonal violence. So domestic violence is anything that can happen within the household. So mother, daughter, father, son, husband, wife, anybody. And then interpersonal violence is between intimate partners like husband, wife, or boyfriend, girlfriend. So with that, I just wanted to bring awareness to our sisters here. So let's talk about mental health. Now, what is mental health? Mental health is very important for overall health and our well-being. It affects how we think, we feel, and we act. It may also affect how we handle stress and difficult situations. So, if we have a strong mental health, if we are mentally healthy, we can take care of other things that are happening. Some things that may not be under our control, but we can deal with them, cope with them if we are mentally healthy. So, and there's a lot of words in here, mental health versus mental illness. Are they the same? I don't know. You guys tell me. No, I'm going to tell you. So just like health and illness, right? We know health is a state of mind that we are content with, we're satisfied with. And we know that illness is, something that our body is telling us to, take care of it. So we're talking about something like positive versus negative, right? So mental health versus mental illness. Now let's talk about the definitions, right? Because if you know what it is, then it's going to make a lot more sense to you. Mental health is your general state of well-being and state of mind, something that should be looked after. So you should be working daily towards, just like we do exercise, we go out for a walk, or we want to make sure that, we are healthy, we eat healthy, just like that. Mental health is very, very important, and we need to work on it actively. How do you work on it? It's like, taking time for yourself. And I'm not talking about, a day. I'm talking about 5 to 10 minutes in the morning. And if you do some breathing exercises, you do some meditation. And alhamdulillah, us being Muslims, we have, built in meditation is our salah. So, but also, along with that, we do need to have our soul nourished, right? So doing something that is really pleasurable for you, not for your kids, not for your husband, for you. What do you like to do, right? So that is mental health. Mental illness is something that disrupts your mental states and interrupts how you feel, think, communicate, and behave. So if you are mentally ill, depression, stress, anxiety, all different other mental health conditions like schizophrenia, personality disorders, bipolar disorder. So just like, you want to be healthy in your physical body, you want to be healthy in your mental health as well. So differentiating between mental health and mental illness is very, very important. So, I really like to show some statistics, right? Just think about it. 1 in 5 Americans will be impacted by mental illness during their families. Now, this is not just specific to Americans. This is anybody who's living in the United States. So just think about it. We are 54 participants in this meeting today. 1 in 5. So if we start counting 1, 2, 3, 4, the 5th person may be mentally ill, right? So it is very, very prominent, even in our community, and it's amazing. So 1 in 5. And if you do, depression is the leading cause of disability in the United States among people ages 15 to 44. Again, that includes our youth as well. And lots and lots of money. But my biggest thing was that the picture on the left says 86% of college students have felt overwhelmed. 86%. 81% of college students have felt exhausted. 30% of college students have felt too depressed to function. And 6.6% of college students have seriously considered suicide. Now, we talk about suicide and, it can't happen in Muslim community. It does. There was a new research study that came out from Stanford's mental health department, which actually they compared the 3 Abrahamic religions, Christianity, Judaism, and Islam, and the highest rate of suicides in between the 3 was Muslim youth. So we really have a lot of work to do. And where does it all start? It all starts at home. Moms are talking to their kids. Moms are the one who are running the household. So it starts at home. So again, here's just Muslim youth. So we were talking about the whole United States, Americans, non-Muslims, Muslims. This is Muslim youth mental health fact sheets. 3% of Muslim youth that were researched or surveyed have substance use disorder, alcohol, marijuana, other drugs. 13% have anxiety disorders, 15% mood disorders, 16% ADHD, like attention disorders, 19% have adjustment disorders, meaning something is happening in their life that they're having a hard time adjusting to. And then 20% other issues, it could be other mental illnesses. So, our youth, even us, are going through a lot. Youth are struggling to balance their identities, have higher depression, meaning, some of them are living double lives. They go outside and they want to fit into their friends, and then they come home and then they want to fit in whatever their mother and father says, right? Plus, when they are outside, they're also dealing with discrimination, especially college students. Black Muslim youths are experiencing a lot of educational, academic, religious, and cultural hostility. So, and visible young women experience more racism, hijab, whatever it may be. So we just gotta be here for not only for ourselves, but for our kids too. And then, of course, unsupportive parenting, right? And I don't want to blame anybody or, anything. I'm just giving you the facts that, there is no support at home. There is no warmth, no, hugging or telling the kids, I love you. And then there's huge control. Parents want to control their kids' lives. And again, I'm not talking about, a lot of promiscuity, but I'm just talking about plain old control. And that impacts the youth's ability to, cope with discrimination, deal with daily life issues, being strong. So, yeah, there's going to be a lot of things that we can learn to not only help ourselves, but our own families. So we are mentally healthy when we are able to manage our daily responsibilities, right? We have meaning relationships with our spouses, with our family members, our siblings, our kids. We are able to cope with stress because there are some things that are not under our control. But being mentally healthy gives us the emotional energy to deal with things that are not under our control. We're able to play and we're able to be happy and enjoy life, because a lot of people come in and say, I feel like I'm just going through the motions day by day, but I'm just not happy, So, and there could be, physical issues as well, meaning, some people have vitamin D deficiency or B12 deficiency or magnesium deficiency. That can cause signs and symptoms of depression, fatigue and not being motivated. So, yeah, it's really important to be on top of it and get it checked out. So we may need help when we experience serious problems in our thinking, feeling, and behaving. What does that mean? We're slow. We don't want to do anything. All we want to do is just lay in bed. We can't think straight. And then, so we have conflicts and distress in our personal relationships. If you are down and depressed, you're going to yell at your kids because you can't control it, right? You're going to have problems at work or school. And then what we do is we try to alienate ourselves. So we want to be, don't talk to anybody. I'm not going to call my sister. Or for kids, I'm going to stay in my room, or I'm going to play the video games because I don't have to deal with anybody. And then, of course, a lot of substance use to mask the symptoms, because substances in reality, actually, immediately, they do give you that relief and they do give you that peace that you're looking for. However, those substances in long-term and chronic use are really, of course, bad for you. They kill brain cells, right? So, but in the meantime, and that's what the people who are trying to deal with these substances, kind of prey on, because that's when they tell the kids, okay, you know what, just use this once or twice, it's going to help you feel better. And it does, and then they're hooked. So again, and it's a long conversation, but these are just the points. So mental illness is not different than physical illness, right? Brain is a part of our body. And if there is something going on with our brain, then of course, physical illness, is the same thing, right? You would go, if you had diabetes or you were having high blood pressure, you would go to the doctor. Same thing, you would go to a psychiatrist or a therapist or a nurse practitioner. It is a medical condition and not a moral weakness or lack of faith. brain, the depression and all of that, it all works with, there are serotonin levels in our body, there are hormonal levels in our body. So it is actually a medical condition. As a medical condition, it can be treated with professional help, therapist, psychiatrist. The difference between psychiatrists and therapists is that psychiatrists mainly deal with medications and therapists do with talk therapy. The good thing about nurse practitioners like me, we can do both. So, and recovery is always possible when there is no cure. So people can live healthy, happy lives if they manage their medications. For example, there's no cure for bipolar or schizophrenia, but people can live healthy, happy lives with treatment. So what is depression and how can you recognize it? So these are the symptoms. They're low moods, like, you're just down and you just don't want to do anything. Changes in appetite, you don't want to eat anything, or you want to eat a lot because you could be emotional eater and you could eat a lot. Sleep disturbances, you can sleep too much. You don't even want to get out of bed, or you can't sleep at all at night because your brain is going, you're just thinking. Agitation, you're just irritated, no matter what anybody says, you just, you're gonna chew them out. Fatigue, you're tired all the time. And then also difficulty concentrating, meaning whatever you read or if you're watching TV, it's like, what happened, an hour ago? I don't know. So difficulty concentrating. So these are the typical signs of depression. Does that mean that you are depressed and you have depression, like clinical? No, but these are the signs that if this is happening, you need to do something about it. You need to go check it out. You need to get yourself screened, talk to your doctor, whatever it may be. So signs of mental illness, appetite or sleep changes, extreme mood swings, this morning you were very, very happy and you want to do whatever. And then at nighttime, you're just, I don't want to do anything or don't talk to anybody. Chronic low-grade depression, unusual emotional outbursts. Some people would say, I just cry all the time for no reason at all. Unhealthy coping mechanisms, of course, alcohol and drugs. And then also sometimes people have hallucinations or delusions, like, somebody's talking to them and they go around looking and there's nobody there, or delusions that, I am the king of this city or whatever, high grandiose illusions. But I also want to tell about postpartum depression here, which is very, very common among women. And we don't do anything about it, right? We say, oh yeah, you know what? It's only because, it's normal. You're not getting any sleep. Postpartum depression, postpartum blues are very, very common, but they should only last about 2 weeks. After that, and if you're still depressed, you're still crying, you don't have, you just can't do the daily chores, then that's postpartum depression, very real, and it totally can be treated. And I mean, the highest amount of postpartum psychosis, which, there's a possibility that you might want to hurt yourself or your baby. So again, get it checked out. If it's not what you think that it's your normal, let it check out. So here we have, and these are the most common myths that we have about mental health in not in the United States, anywhere, I should say, in Muslim world. Myth number 1, Muslims don't have mental health issues. Wrong. Muslims are humans, right? And they have mental health issues just like anybody else. Myth number 2, dealing with a mental illness is a sign of weak faith. Now, this is what I deal with a lot when we're talking about domestic violence and stuff. The number 1 place when anybody has a problem within the household or anything, they go to the masjid and they go to the imam. And I've heard more than not that the imam say, you know what, just go ahead and pray and make dua. That's good. That's really great. Go ahead and pray and make dua. But if it is a mental health problem, they're not equipped with, dealing with that. So what we are now working on is we're taking on training the imams for, what to say, what not to say, and then also giving them the resources. So if somebody is coming to them, they can hand them the resources and say, hey, here, I think you need to go get yourself checked out. The field of mental health is a modern invention and not a part of our tradition as Muslims. Again, wrong. The first psychiatric hospital was built in 8th century, and that was built by Muslims. And it was actually supposedly a beautiful place, where they took care of your health by meditation, breathing, really nice gardens and stuff. So the field of mental health was, or the treatment of it was started by Muslims. So, of course, we talked about depression. Let's talk about stress and anxiety. Again, those are, if you don't take care of stress and anxiety, they can turn into depression and then turn into mental illness, right? So the difference between stress and anxiety is that stress is short-term and anxiety can linger long-term. Now, stress is not bad. Stress is good, because when we are stressed, we get that cortisol going, the hormone, and we do something about it, right? If I'm stressed about a party, I'm going to go ahead and cook and do that. And then the party is over and I can relax, right? So the stress is down, the cortisol is down. Now, anxiety, the cortisol goes up, but it never comes down. So that's chronic stress, chronic anxiety, and that actually does play havoc on your body. You can get body aches, you get your tension headaches, you can get your shoulder aches. So again, this kind of tells you that the signs and symptoms. So some signs and symptoms are for stress, and some signs and symptoms are for anxiety. But the middle part is that can be either a stress or anxiety, right? Like your faster heartbeat, faster breathing, or diarrhea or constipation. Even with kids, sometimes to find out if they're anxious or not, they're going to come in and say, I don't want to go to school. Why? Because my tummy hurts. So, and there are different things that the kids can bring out stress and anxiety. So just keeping an eye on. So what is our job? Our job is to recognize, we need to normalize and reduce the stigma that there is nothing wrong with getting help, right? Go to the doctor and they can tell you, okay, yeah, there's nothing wrong with you, fine. But you don't want them to say, okay, why didn't you come sooner? So it is okay. There's nothing wrong. You're not crazy if you're going to a therapist. Actually, we therapists don't do anything for you. We just try to help you process what you're thinking and then give you some things to think about that can help you make your own decision, because we can't make a decision for you. We can provide resources, so we can tell you, okay, this is the place you can go. There's a therapist, there's whatever. We have a lot of domestic violence resources as well. We encourage you to seek help, and then we provide support. We can't, or we shouldn't be telling people, well, you know what, just fine, just get over it. No, I understand that you're feeling this way, because if you're feeling this way, it's normal and natural for you. So what are we going to do about, why you're feeling this way? So finding out the root cause. Here's some healthy ways to cope with stress. Know what you're going, but also from a good source, what to do and who to contact and where to get treatment, because you don't want to go to Dr. Google and WebMD, because there are some resources that can lead you, the wrong way. Manage your emotions, breathing, meditating, doing your salah, reading Quran, taking breaks from information, turn the TV off. Sometimes it's just over and over and over again, the same thing. Stay away from social media, meaning, take a break. Social media, actually, the new things that are coming out or research is coming out, is the highest reason for depression in especially the youth, because, now that we can't see each other, we can say, troll, belittle people, and we don't have to worry about it because they don't know us, right? Sometimes, things that are happening in people's life, and then they put it on social media. So you know, doesn't matter if it's true or not, but then other people see it and then they say, okay, well, you know, I wish I could have that. And the other thing is that, you know, you are exposing yourself to, you know, nazar and evil eye and all that. So being careful with that. Take care of your body, eat healthy, exercise, sleep is really, really important. And sleep can play havoc on your body. You know, sleep is related, lack of sleep is related with heart disease, diabetes, you know, all of those other physical conditions as well. And of course, avoiding tobacco, alcohol, practicing self-care, something you enjoy, make time to unwind, right? You are busy, you're on the go from morning to night. You need some time off. Even machines, right? They do need to turn off sometimes. Otherwise, you know, they're going to broken. So 5 to 10 minutes in your daily life to make time for you. Nobody else is calling you or needing you. Um, Again, where you get your news, find the true news. If you do want to listen to the news, connecting to others, talk to friends, family about how you feel. It's okay to let them know, look, you know what, I'm feeling sad today, and that's okay. Or I'm feeling very stressed. That's okay too. Of course, the people you trust, and they're not going to go out and talk about you all over the community, right? And then do what you can to help. Food donations, sharing good news, even small gestures. Call your friend just to check in on her, how she's doing. So when you do volunteer or do things for others, it just automatically gives you satisfaction and happiness. So, what to do, even for our own mental health and a friendly home? I mean, these are really, really tiny. I'm sure you can't read it, but you know, we can send you the this infographic. This is from FYI. If you wanted to go FYI, so it's Family and Youth Institute. They're doing great research, and they have a lot of resources about, you know, Muslim youth mental health, suicide prevention, all of that. So, but you know, creating a safe place so the kids can come in and talk to you instead of, you know, if somebody's coming in and they want to talk about LGBT issues, right? Instead of saying it's haram, we don't want to talk about it, don't ever about this again. No, you need to talk to them because that's what they hear and see outside. So if they have questions, talk to them with, you know, in the light of Quran and Sunnah, because we have everything available within Quran and Sunnah to talk about. So, you know, encouraging talking to your kids, just, you know, playing with them. And actually, while playing with them, you can really talk to them about their day, what happened. You can see how they're dealing with losing and all that. So yeah, this is what we can do for our families and, you know, ourselves. So this is a good acronym to think about. It's SAFE, safe. See the signs, listen without judgment, and assess for risk. Sometimes what happens is when somebody is trying to tell us something, all we want to do is fix it. You can't fix it. They have to fix it. So you can listen. Don't, you know, you can't undermine them. You can't make fun of them. Listen, and then also assess for risk. You know, if somebody's coming in and telling you that, you know, they're thinking about what is it, you know, why am I alive? You know, I just don't see a purpose in life. You need to assess for that because that could be, you know, they're thinking about hurting themselves. Acknowledge the distress and assess for the severity of the impairments. You know, yes, I understand you're feeling that. What is going on that you're feeling that way? Find best respond to de-escalate, reassure, and emotionally support. Encourage to see professional help and support when possible, and link to affordable behavioral health care. You know, there are, you know, insurances are now covering mental health and therapy. There's a lot of, you know, pro bono. We have Khalil Center. We have Maristan in Northern California, but they do telehealth and they do free work, and they also do, you know, basis on your income. So a lot of help is available. Okay, any questions now? This is just a funny, brownies are health food, because if you count mental health, because chocolate is good for mental health, right? So yeah, any questions, anything that came up for you?
Let me check the chat. Okay, I don't see any questions. Sisters, you want to come up on the mic and ask a question, or you want to save it for later? I think we're good for now. You can move on.
Okay, yeah, and if there are ever any questions, just you can shoot me an email, and then we can talk.
Okay, so
I can put my email in the chat as well. Let me see here.
okay, so are we moving on to another part of the presentation, or are
Nope. That's it.
Hello, Assalamu alaikum. Give me one. Shabana.
Yeah.
I'm Shaheen. Shaheen from Misani.
Oh, okay. Assalamu alaikum.
Walaikum salam. I was listening to you about the signs of depression. So there are a few of the symptoms that you were talking about, and like crying, I'm feeling fatigue, I want to sleep. Sometimes I want to eat more. Sometimes I don't want to talk. I cry. You know what happened with me last few years. So is
Yes.
it connected with that, or maybe? And I'm not feeling good right now. I have flu. I'm taking antibiotics. But can you just throw some light on it? A light on it.
Throw the light on what? I'm sorry.
Is this called depression? Should I go for depression, or this is the normal signs of I'm not feeling good, and I've been taking antibiotics and pain medicines, and I'm feeling very, very weak. And that was because of my last year's radiation and breast surgery. So my doctor said your immune system is weak.
Yeah.
So is that I'm confused between depression and this illness?
Sure. No, that's a great question, because yes, you need to have, so yes, when you are physically sick, you are going to feel down and depressed, right? Because you are not able to do things that are, you were doing previously. You're not doing things that are pleasurable for you. You just physically don't feel well. But if it lasts for more than 3 weeks, then 3 to 4 weeks, then you need to talk to somebody who can help you process even this sickness. Sometimes when we don't take care of our again, stress, because physical sickness is stress on your body as well. So when you are not when you feel that way, because now, and it could a lot of be with grief as well, right? Grief of your not only things that are going on in your life, but also you just mentioned that your physical sickness, that's actually a loss of something, right? So that's grief as well. So I would say, if you're feeling that way, if it's been more than a year, more than a month, then definitely talk to somebody, because they can help you process all of that, right? They can help you with doing things that are a little bit pleasurable for you. So kind of bring you back to the way you were, even though the sickness is not under your control. You're doing whatever you can. You're taking antibiotics. You're doing whatever in your power you are. But again, as I said, if it lasts more than a month, talk to somebody.
All right, I have a question written down.
Sure.
Sister is saying that what if you're how can you convince someone to go see a therapist, especially when they feel like they don't need therapy?
Of course, that is the biggest question, because they don't need it, right? And especially people with mental health, and other different personality disorders, they want to say that there's nothing wrong with them. It's all is wrong with you, right? So what you can do with those people is you use that I terminology. Like, don't say that you need therapy, or you need to do ... or you are doing this. You just say, you know what, I feel that things are going to be a lot better if if we went to therapy, or if you get help, kind of thing. You just got to be really, really not only just supportive, because sometimes this is not possible, and especially with our couples here, we see a lot of gaslighting. There's a lot of things going on with this husband. And when I just recently saw a case that it was domestic violence, and he slapped her, and when they're here, he's like, well, if she wouldn't have said that, then I wouldn't have slapped her. So those are the things. Now this couple really, really needs help, but you just have to keep repeating them. You just keep reminding them, what? And then there has to be a consequence too, right? Maybe you need to go in and get yourself some therapy, or you need to go to your doctor so you can help yourself. Remember, you can't control others, right? So you can't control him, but you do need some coping strategies and coping mechanism so you can help yourself while the other person is not getting help. So yeah, I mean, you need to take care of you.
So there's another question by a sister saying, does mental sickness happen, or mental health issues happening when you are getting through divorce?
Definitely. Because remember, mental health issues can exasperate or stress it really, really high, very, very big changes in your life. For example, getting married, divorce, moving, having some sort of a conflict. Those are the main times that, your stressors are at a very, very high point. So yes, if you are in the process of getting a divorce or thinking about it, I highly recommend talking to somebody, because then they can help you process all of that. Because remember, you're right in the middle of it. So you're having a hard time thinking and finding out what's best for me. Now, again, the therapist is not going to tell you what's best for you, but they're going to give you some ideas so you can think about, and then you can make the right decision. But yes, mental health issues go way high up when there are huge changes in your life.
All right, Sister Shabana, I'd like you to shed some light. We've been through this period of COVID and now post-COVID time. So have we been what were the issues that we, especially as Muslim families, faced, and we're also seeing their consequences or their effects past COVID, and how to deal with them? If you can mention a few.
Sure. So, yes, I mean, within COVID, everybody was, locked up in the house. We saw a lot of sickness. We saw a lot of grief. So now post-sickness, not a lot of people, now we have to go ahead and adjust how are we going to deal with outsiders. So we saw a lot of depression. We saw a lot of anxiety and stress, of course. But we're also seeing a lot of social anxiety, meaning I don't want to go out, or if I go out, I don't want to talk to people. But within the family unit itself, we saw a lot of domestic violence. And it's not just between, husband and wife. We saw it a lot of between families, meaning mom is getting mad at the kid, and the kid is depressed because he's just sitting in his room playing video games. There's no, talking around, and everybody's in the house. So everybody was on each other's nerves, right? So yeah, we see a lot of depression. And we just got to come back to, what normalcy was before. And it's not going to be the same normal, but we got to come back to our new normal, right? So yes, we did see a lot of depression, and we're still seeing it, actually, because at work at Kaiser, actually, I can give you the idea that I had about 200 to 250 referrals per month in January. Last month it was 600. So, it's doubled and tripled. A lot of people are just anxious, what's going to happen next, because this was something that nobody expected. There was no cure for it. So it was a lot of anxiety. How can we deal with that? Again, talking to somebody, making it normal. It's really normal to feel this way, and letting your kids know that, you feel scared, I feel scared. Let's go ahead and make some routines. So having a routine really helps with stress management. So you say, okay, you know what? Our routine is going to be that we're going to eat dinner together at this time. So no matter where the kid is, um, playing games or being on the phone, but they're going to come in. We're going to have a routine, 8 o'clock. Dinner or whatever, playing playing board games, getting involved in your kids' life and letting them know that you are available if they want to talk. So does that answer your question?
Yeah, kind of. Yeah, alhamdulillah.
We did
So,
we did a whole presentation
mhm,
for COVID and what to do about COVID related stress. Maybe
mhm,
you can share that recording with people.
sure. All right, Sister Hile, she has a question. You want to unmute yourself, Sister Hile?
Ji, Assalamualaikum.
Walaikum salam.
My question is that, as you said, during COVID, a lot of kids went through depression and anxiety. A lot of times, actually, this came in a conversation between a couple of young mothers where, we discussed if it's a good idea to send your kids younger than age of 10, or I would say 11, 12. These kids, is it a good idea to let them speak to a stranger, like a therapist or psychiatrist, especially if they're non-Muslim? Because a lot of issues that these kids are going through um, are things that needs to be addressed in Islamic manners, or needs to be, and even the question came that, does these kids really have mental issues? Yes, my opinion is yes, kids as young as age of 4 and 5 can get depression, but then a lot of people have this question that whether these kids can get that young, they can get mental health issues, and they can get, I have seen it, I have experienced it myself. So for me, I know it is, but how true is this that, kids younger than 4 or 5 can get, depression? And if it is a good idea to let them speak with the psychiatrist or therapist who's non-Muslim.
Okay, that is a great question. And I can talk about it a couple of hours giving you the answer. So number one is, can kids younger than 4 or 5 get mental health issues? The answer is yes. We have therapists specializing in infants. We have therapists specializing in 2 or 3-year-old toddlers. And then also we have, for kids, child, adolescent. So it doesn't matter what age you are, you can get definitely illness. Now also know that autism and ADHD are also considered mental illness as well, right? And what under my experience has been that people don't want to do, they don't want to go to the doctors and stuff for those kind of reasons, because what people are going to say, right? Log kya kahenge? It's like, what are people going to say? Oh my God, no, I'm not going to taking my kids to therapists. People are going to know, right? So yes, kids do get mental illness, mental health issues. The way you can actually see that the need is there is by, they're going to start having behavioral issues. They're going to start having, issues with their attitude. Now, I'm not saying that every kid, who has issues with attitude has mentally ill. No, I'm not saying that. Kids are going to be kids, but you would know as a mother that this kind of attitude is normal, their hormones or whatever is going on, but what other they're doing is not normal. So you would know as a mother. So yes, kids can have it, and I highly recommend them. The sooner you get them in, the better it's going to be. Why can kids get that? Number one thing is that sometimes mental illness is genetic, right? So you can get it, especially bipolar illness and all of that. That's not going to be diagnosed until the kid is 18, by the way. But autism, ADHD, dyslexia, learning disabilities, all of that can be diagnosed earlier. Sometimes the kids are upset because what's going on in the household. So when a kid comes to us, when we are talking to them, number one thing we want to know is what's going on in the household. So if a mother and father are having a stressful relationship, it's going to affect the kid. If mother and father are yelling and screaming at each other, it's going to affect the kid, because kids automatically think that what's happening is their fault. So, number one thing we have to see is what's happening in the household. I really did see somebody day before yesterday that the kid told me that mom and dad are getting a divorce, and she's the only kid, and mom talks to her and dad talks to her, and she has to go in between parents, and they talk nasty about each other. Poor kid. What a strange position and what a horrible position to be in for this child. So things like that. Yes. Now, the other part of your question was that Muslims and non-Muslim therapists. I agree. It really depends on what is happening with the kid, right? So there are some things that, yes, it doesn't matter, Muslim, non-Muslim, male, female. However, I do agree with you that there are some things that a non-Muslim therapist is not going to understand, right? For example, a kid comes to me, or, so she is a female, almost like 17 years old, and she wants to wear what she wants to wear. And there's a huge conflict between her and her mother. So mom thinks that there's something wrong with her, and she sends her to therapists, and non-Muslim therapist, and non-Muslim says, oh, you're going to be 18 in a couple of weeks. So do what you need to do. Why is your mother telling you what to do? Right? So there's a difference. If a kid, the same girl, would come to me, there's going to be a lot of talk about why we do that. Why is, covering your body is most important. So things behind why. I think what we do, and that's what we learned, is that we tell them what to do, but we don't tell them why. So, so yes, there is a difference between a Muslim therapist, and that's why we have so many Muslim therapists now around. And with this telehealth, they could be anywhere in California, and you could talk to them. So yeah. Does that answer your question?
Yes, thank you so much.
Also, I don't know, but if you can clarify, can I, any child, underage child, do they actually, when they're in therapy, they have to be in the presence of their adult parent or guardian?
Not necessarily. Depending on what is happening. If the child is under 12, we have to get the parents' consent, but we don't have to have the parent inside in the room, because there are some things that the kid is not going to talk about if somebody who he or she is afraid of is in there, right? Or they can get in trouble. So that's the reason. We do have to get a consent, but the parent doesn't have to be in the room.
Okay. All right. My other question is, we as Muslim community, what can we do to help such individuals or families going through a tough time? For example, like we see many times, families that are going through divorce, they're ostracized, hijabi sisters ostracizing and judging non-hijabi sisters, and kind of forming their own separate group and looking down upon them, or simple things such as delivery, postpartum depression, people having financial difficulties, job losses and all. So could you shed some light on that?
Yes. And that's the it's too sad. It's sad and unfortunate that we are we have that in our community, and I don't deny that. We have had a couple of actually few months ago, 6 months ago or so, we had about 4 or 5 shootings with, this disgruntled husband shot the wife. One of those girls had gotten a divorce already, and she was living, in a different city, and he went in and he shot her anyways. But she had a blog going, and on a video blog going, and she explained this, and she said, look, when I got a divorce, the whole community shunned me. Nobody came in and, wanted to not only just talk to me, but support. Hey, are you okay? Do you need anything? No, everything was, yeah, so she didn't get any help. So I totally agree. If we just go to the basics of Islam, we cannot think that we are better than somebody else, right? We don't know what's in anybody's heart, and we cannot judge. So if we were to go back to the Islamic things, then we can be a better community for our sisters. So there is nothing wrong with being a divorce. Prophet ﷺ's daughter was divorced. So, and I'm not saying that, just first thing happened, you just go out and get a divorce. No, you try to do as much as you can to mend that relationship. But if it's not, then divorce, right? So yeah, we have, as a community, we really have to learn a lot, and we have to work a lot on including and being the same, non-judgmental. That's one of our things, that we're very judgmental to other people. Anything else?
More question that a sister is requesting. So her question is, what kind of medication is legal for stress relief that children are taking overdoses and then passing away? She wants to want us all to be aware so that we can protect our children.
Yes, great question. I just dealt with it yesterday, even though it was a Saturday. Number one thing is marijuana. Okay, it's very easily available. It's legal in California. Schools are the first place you're gonna get it for young children, and they don't think that it harms them. Okay, yes, in smaller doses, it's not gonna harm them, but if they're gonna take it more and more, it will affect not only their growth, but also mental capability, right? It kills brain cells. So number one thing I feel that our youth is doing is marijuana. And then number two, that's actually killing kids, is fentanyl. So what the people are doing is, when they give, any other, say, oh yeah, this is not a good, this is not, you're not going to get addicted to this, take this pill and it's going to make you feel better. Well, that pill is actually laced with fentanyl. And fentanyl is a product that if you touch it, you can get really, really, even by touching, you can, die from it. And just a week and a half ago from Riverside, they did, I think, I don't know how many, 200, 300 pounds of drugs that were laced with fentanyl. And it could kill, I don't know, 1 billion people or something. It was a huge thing. And I'm like, wow, but the biggest thing is marijuana that our kids are doing. Yes.
All right, Jazakumullah khairan, mashallah. Great questions, great presentation. Sisters, if you want to have any question, you can come on the mic and ask yourself. You can raise your hand. Let me know. So alhamdulillah, it was really good to hear, Sister Shabana, what you mentioned, that the science also started by Muslims, alhamdulillah, taking this into account. And it was also nice to hear the difference between stress and anxiety, where stress is actually a temporary thing, and it may be a good thing, or maybe a healthy stress, where anxiety is is a long-term and thing, a longer term thing, and it has symptoms. And it's good to know, for the reason that for some reason this mental health issue is so tabooed in our Muslim society, that it's good to know that Muslims are people too, and they will have same issues as other human beings.
Right,
And
right.
alhamdulillah.
And there's a question, one sister is asking, does that happen to a child that is going through that process with the parents too? So yeah, parents, I believe this question is related to the divorce process. So yes, the parents are going through the same, and child is going through the same thing.
Yeah, even I've noticed, Sister Shabana, even with movings, changing schools,
Yes,
you know, everything, like your sibling going out of house to a college, right?
yes,
Anything,
yes,
dynamic changes, family dynamic changes, your friends moving out of the school, anything can wreak a havoc on your mental state, correct?
definitely, definitely, yeah,
Yeah.
yes,
Having too many young kids, like going through delivery, postpartum, like, so these are
yeah,
all weird things, subhanallah.
yeah.
And so I just want to summarize by saying that the good, okay, so there's a question sister asked me, what if your spouse doesn't agree with you? Um, I don't know, doesn't agree with you regarding that you have, uh, you need to go to a physician, or you need to go to a therapist. Is this your question, sister? What the sister's asking, what if your spouse doesn't agree?
Depending in what way, right? Your spouse doesn't agree in if you are having, if you are down and are bleeding, and he doesn't agree for you to go to ER, well, that's not okay, right? Depends on what is it that your child, if it is, you're going to buy a sofa and your husband doesn't agree, that's a different kind of not agreeing than anything else. If your child needs mental health therapy, or you need something, and then your husband says no, you can't do that, well, that's a problem, and you need to get either your family involved or masjid involved or whatever. But that is not okay for because remember, marriage is even in Islam, you have to respect each other, right? And respect means that you're not trying to oppress one person or the other. You're not, the wife is not a husband's slave, she's his partner. So if we know that, then then things can change. Now, if your husband doesn't agree for couples therapy, that's a different story, right? You cannot drag him. So what you need to do is you need to get your own thing, so then you can get the tools and coping mechanisms, so then you can talk to him about what's going on. So, you need to have that kind of, information, self-esteem, and things that you can talk to them and say, what is wrong? Why are you not happy? So the email address that was shared was my business. It's body and soul health center.com. So you can email me there, or my phone number is down below as well.
All right, Jazakumullah khairan,
Assalamualaikum,
sister.
Farheen. Yeah, I truly want to, this is Ifat. I want to compliment Sister Shabana. I think she covered such a broad spectrum of this issue.
Thank
And
you.
definitely it's very timely, and it's a very needed topic to be talked about. And Jazakallah khair for your time.
You're so
All
welcome.
right. And also there's a sister who's saying, Jazakallah, Sister Ifat, does mental health
Sure.
make it hard for the child to focus in school? I would say yes, but
Of
you can.
course, yeah. Of course, yeah.
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 And there's another question. How's confidentiality maintained if you were to seek therapy from someone from your community? How are boundaries maintained in terms of keeping confidentiality or absolute confidentiality?
Well, that's a legal issue as well for the therapist or the psychiatrist. You can lose your license if anybody can say that, the confidentiality was broken. But I can ask you, have any of you heard anything from me about anybody else, right? So it is a professional thing to do. It's a legal thing to do, that it has to be maintained. Confidentiality has to be maintained. Once you become a provider for the other person, then the the friendship part of it kind of, puts aside, and you're their provider. So no, confidentiality has to be maintained very, very strictly.
And I guess this is one part why, because we as Muslims family, we are very discreet. We should be discreet about our internal matters. That this is another part that scares you, that if you're going to talk about it, then you're going to be talk of the town. So
No, I agree.
clarifying.
We had at the masjid, actually, we had hired a year, 2.5 years ago or so, we hired a therapist, and she was coming in and sitting at the masjid for maybe 3 hours a week or something. Not a single person came to her. And why? And I know because people were coming to me, and I'm like, you can get it free from the masjid. Why are you? And they're like, no, we don't want to walk into the masjid because people will see it, right? People were going in, or still go to now Imam Ubair, but with Sheikh Jamil, they used to do a lot. People used to come, but they would come, after hours or in the morning that nobody's there. So yes, our in our community is what people are going to say is very important. But you know what? There comes a line where you have to draw the line. I mean, if you are really getting, has problems, mental illness, stress, anxiety, depression, or if you're being abused, not just physically, but emotionally and, mentally, then you need to talk to somebody.
Yeah, I would just like to comment on that, sister. Maybe there's a reason why people avoid, maybe because we're not practicing the hadith of Rasulullah, that whatever is not concerned, a moment is the person who leaves anything that's not concerned to him. So maybe we really get into, we as people, we need to check as people in our community, we're not getting into other people's business, and we're not curious about it, and we're not trying to dig into their personal matters.
You don't have to dig into their life issues, right? But what you can see, if you see a sister who's down, she's not acting the way she used to act, there's something, you feel that there's something, all you have to do is say, hey, is everything okay? Are you okay? Now, if she chooses to talk to you about it, then that's great. Or you can say, hey, I feel that you're not yourself. I feel something is going on. Please, I would suggest that go talk to somebody, so that you can do. You don't have to go, going into their personal matters. But to sisters who are going through that, it's okay to go talk to somebody, because, even with this Islamically, we have to take care of our mental health.
All right, Jazakallah khairan. Dear sister, mashallah, it was a great discussion and a great talk.
Yes.
Ameen, summa ameen. And inshallah, I would like to conclude with a few points from your presentation, that where you suggested that maintaining a good mental health consists of having a good sleep schedule, having a healthy diet and exercise plan, and having healthy relationship, also connecting with families and friends who you trust, having that quality time, also having a me time, and also helping others. When you help others, then Allah helps you, and you feel better. Jazakumullah khairan, dear sisters, inshallah. So we will be closing the session. Before we close, I would like to let you guys, inform you guys, and remind you that we have this conference coming up. It's called Reviving Our Values. It's a ICNA SoCal Conference 2022. It's on Saturday, December 17th, and it's in Knoxbury Farm Hotel. We have very esteemed guests who'll be coming and talking, inshallah. So please support this cause. There will be a bazaar vendor, and if you would like to go, there is a vendor booths available, inshallah. So we would really like to invite you and encourage you to come and also share this message. Jazakumullah khairan, dear sisters. I'm going to conclude it with the dua. Wal asr innal insana lafi khusr إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. Amin. Amin. Inshallah. See you, sisters. Inshallah, in January.